Hello. It's fabulous to be here. I was actually in New Zealand yesterday, so it's great to be back home. I was complaining though to my family and the like about how bad Auckland traffic is. Can I tell you, Melbourne really did itself proud this morning. So can I welcome everybody here, all our speakers, all our delegates and all our participants today. I'm heartened to see so many of you here attending this important conference. And in the interests of time and in fear of the bell, that was Monica's very serious threat, can I just acknowledge all of the dignitaries that are here, but in particular to Gerald, thank you for organising this conference, and to your team in particular. I'd also like to acknowledge and pay my respects to the elders and the traditional owners of the land on which we stand, the Wurundjeri people. Now, it's my very great pleasure today to officially open this VicHealth conference, Policy, People and Prevention, Ending Violence Against Women in Victoria. It is timely indeed, with the Royal Commission's public hearings commencing just yesterday. And I know that we'll be hearing from a great many experts and thinkers in this critically important field, but I thought today, as Australia's first Minister for the Prevention of Family Violence, I'd begin by sharing with you some of my own reflections on the many challenges we face, with particular regard to the important role governments can and must play now and into the future. Like all big institutions and big businesses, innovation and change does not come easily to government. Moreover, and not surprisingly, governments do not rush to embrace criticism and its own failings. Governments follow a very different and well-trodden path from that envisioned by those demanding self-reflection and change. And it's one of the key reasons why we've seen such little progress over the very many decades emanating from governments or our police or our courts, despite all the evidence of harm, despite all the efforts of peak bodies like VicHealth and the calls from our NGO sector and so many victim groups, and of course from victims themselves. But now, here in Victoria at last, something has clearly shifted, and you can almost feel that shift. Building on the incredible work of the non-government sector, and importantly too, on the courage and conviction of survivors like Rosie Batty, we have reached a critically important tipping point and arrived at a genuine opportunity to deliver lasting reform. Tackling family violence is for our Premier and for our Cabinet a key priority, our number one law and order issue, in fact. And when the Premier appointed me the first Minister for Women, the first Minister for the Prevention of Family Violence and Minister for Women, he did so understanding that gender inequality and discrimination against women are intimately linked. He knew that family violence prevention in our state would need to begin with a conversation with the Victorian people about the connection between gender and violence. Now, this is not an easy conversation, nor does it happen very often. While there has been growing appreciation that racism can lead to racial violence and homophobic attitudes can lead to gay hate crime, there is a poor understanding of how casual or systemic sexism fuels gendered violence, or how the threat posed by sexism and violence contributes to the ill health of women. And in the important area of prevention, we've seen already talk of the campaign message that will need to be sent out to every workplace, school, sporting clubs and religious institutions. We've seen these kinds of campaigns before, the quit campaigns, the 0.05 campaigns and seatbelt campaigns, etc. But the hardest nut to crack is going to be a woman's place in our society and all the structural barriers that in fact make her in our society a second-class citizen. In our whole of government submission to the Royal Commission, we emphasise the growing evidence connecting gender inequality and family violence, citing VicHealth's National Community Attitude Survey as one of the number of sources evidencing this link. We also referred to the work of the Royal Women's Hospital in raising awareness of the impact of family violence on the well-being of women. For those of you who've taken the time to read our whole of government submission, you will know that this is not a shy document. When our government sought to pull together a review of all the things the Victorian Government does to respond to family violence, it did not sugarcoat the problems, nor did it wish to inoculate government from criticism. Our submission instead was shaped by the experience of victims of family violence, who told us that the system designed to protect them is chronically unwell. So we drew the Royal Commission's attention to 10 gaps where policymakers had let women, children and other victims of family violence down. We delved into complex and difficult issues, diagnosing problems and admitting that we weren't sure how best to treat some of them. And we asked the Royal Commission for specialist advice. Not surprisingly, there were many people and organisations who wanted to push back against our diagnosis. Individuals and institutions who believe that the problems we identified are so complex and so difficult that they're incurable. People and organisations who would rather slap on yet another Band-Aid solution. Band-Aid solutions are what put Luke Batty and his mother's life at risk. They are no longer good enough. The first road to recovery for any patient is coming to terms with an illness and seeking help. Sadly, some institutions within our family violence system continue to refuse treatment or to acknowledge the harm they do to others. One of the areas that in the family violence system that clearly is in need of urgent treatment is in the area of prevention. Although VicHealth has provided a cutting-edge framework for preventing violence against women and has led health-centred responses for a decade, successive governments have been slow to embed its agenda across government. Governments have failed to distinguish between universal prevention strategies targeting the key determinants of family violence from other strategies focused on contributing factors of alcohol and drugs, mental health and pregnancy. Prevention initiatives have been lumped together in an ad hoc funding round with nuance or strategy or measures to track success clearly lacking. And worse still, gender inequality has become a marginal part of a confused prevention framework. It is in part for this reason that we initiated the world's first Family Violence Index. It is our hope that the index will assist in the delivery of our prevention agenda by driving innovation and reforms against a regular and easy-to-report target. We hope too that the Royal Commission will take up the importance of developing a strategic and nuanced prevention strategy that complements the Family Violence Index as part of its recommendations. We also hope that the work being undertaken by ANROS, VicHealth and Our Watch to create a national family violence prevention framework will have gender equality at its heart. Our government means to address the link between gender inequality and family violence in any event. It's why one of our first announcements of our government was a commitment to the lifting of the percentage representation of women on paid boards to 50%. Because if you're going to go out and talk about the need to prevent violence in other people's homes, we need to get our own house in order and ask the right questions to do so. So why is Australia ranked 6th last out of OECD countries for gender inequality in our parliaments? What role can all political parties play in addressing the problem of women's representation? Why is our Victorian public service workforce predominantly female, up to 60% on 2014 figures, yet women in executive positions make up only 34% of our senior public policy makers? Why are only 26% of the total number of judges, associate judges and magistrates in our state women? If the primary institutions in Victoria, the Parliament, the Government and the Judiciary, fail to meet gender equality targets, how are we supposed to address the link between gender inequality and gendered violence? How are we supposed to take the community with us on a journey for change? These are the questions that truly do keep me awake at night. Yesterday, as I say, I returned from New Zealand, where they talk about family violence as an epidemic. They believe that the negative effects of violence spread rapidly from one person to another and from one generation to another, like an infectious disease. If we are to truly prevent violence against women, we will need to understand the intergenerational contagion of violence and take affirmative action to interrupt its brutal cycle. This will require lots of people of bravery, people who will walk their talk. While I was in New Zealand, I met with an impressive, very impressive young woman, Superintendent Tasha Penny. Tasha is leading the New Zealand Police Force's work to improve responses to family violence, and she truly is an extraordinary person. She was a whistleblower who spoke out against gendered violence and discrimination in the police force itself, and who's been rewarded for her efforts and commitment to call out the mistakes and be part of the solutions. While we met, one of the first things she asked me was about Christine Nixon and what she was like as a leader. The appointment of our first female Chief Commissioner had clearly inspired another young woman in another country to lead. Meeting her reminded me once again that just one of the most important things a progressive government can do is take proactive steps to appoint women to senior leadership roles, establish gender quotas and targets, and commission gender audits and accountability measures. These practical and powerful interventions against gender inequality and gendered violence inspire future generations. We know it's not going to be an easy task. There is already significant opposition even to the notion of a link between gender inequality and violence against women, let alone to significant reform. But I do believe that the mood has shifted. Importantly too, government has shifted. And as the biggest organisation or biggest business in town by a significant margin, its leaders, politicians and bureaucrats alike need to become vehicles for lasting change. They need to walk the talk. Finally, I'm very proud to be here today to launch a toolkit designed to build lasting structural change within Victorian businesses, the Equal Footing Toolkit, and I understand there are copies of it here. This practical how-to guide will help private sector organisations build greater respect and equality in the workplace. The toolkit, developed by VicHealth with support from En Masse, has been funded by the Victorian Government. What makes it unique is the involvement of a wide variety of industries and sectors, including travel and tourism, retail, hospitality, human resources, family services, finance and engineering in its design. I encourage all organisations and workplaces to access the toolkit and discover how they too can make a difference on the issue of violence against women and become leaders in gender equality. Congratulations to VicHealth, to En Masse and the businesses that participated in the toolkit. I commend you for the work that you've done and in providing such a useful resource. There is, of course, tremendous energy around preventing violence against women in Victoria right now, but that energy needs to be targeted and it needs our ongoing support if it is to be sustained. This toolkit, along with the work that will be undertaken at this conference, will no doubt help us reach our shared objective. Once again, welcome to the conference and thank you for your commitment to reducing gender inequality and for making violence against women history in Victoria. Thank you.
Authorised by VicHealth, 15 to 31 Pelham Street, Carlton, Victoria.